So the things that we want to walk through today is, of course, the latest data from the healthcare systems that are part of the task force in the region. As I mentioned over the weekend, though, it's really important not to pay too much attention on the changes from day to day. Really, what's important to look at is trends, because they're going to be reflective over the long range and not necessarily over the short range. What we know for sure, though, is based on our modeling and best predictions, is that the next couple of weeks are going to be extremely difficult for the St. Louis region. And so again, I'll emphasize that it's really important for all of us as a community to come together, decrease the spread, and that in turn is going to save more lives. And we know the only way to make it easier for us is if everybody practices all of those efforts with social distancing, hand washing, keeping surfaces clean. All of those things will help. So with that in mind, let me walk through a little bit of the data here. So as you can see, the hospitalizations have increased from 468 to 545 today. And the number of patients in the ICU has also increased from 164 to 224. And as I mentioned yesterday, typically we see around 70% of patients in the ICU will require ventilators, and we're seeing that trend hold true with the numbers today, with the ventilator numbers going from 139 yesterday to 172 today. So let me repeat those numbers for you. Yesterday we had 468 hospitalizations. Today we have 545. ICU was 164, and today it's 224. And ventilators were 139 yesterday and 172 today. So as you can see, these numbers are increasing, which is what we expected. These are what our models have shown, that we are on the steep part of the curve right now. And according to our models, we will be going through our peak within the next 2 to 3 weeks. But again, how we get through these difficult times is really dependent upon us as a community and not necessarily as a healthcare system. So many of you have heard me talk about repeatedly about our two-phased approach, about the hammer and the dance. Now, our current modeling shows, and I said this over the weekend, that we will most likely have around 80,000 people infected by the coronavirus at the end of April. Our modeling shows that this could result in anywhere from around 1,300 hospitalizations up to somewhere over 3,000 if we get into extremis. That upper number would put an extreme amount of pressure on the healthcare system, and it could overwhelm our ICU capacities and our ventilators. So the goal is to not get near that top number. And the way that we stay away from getting near the top number isn't dependent upon the healthcare service. It's dependent upon the community by decreasing the spread. If we decrease the spread, we decrease the number that are infected. If we decrease the number that are infected, we decrease the number of patients that require hospitalization. And if we decrease that, then we decrease our numbers in the ICU, and we decrease the number that need to use a ventilator. The whole goal of this is to flatten the curve, so to speak. We will save lives if we all do our part, and the biggest part really comes from the community. So keep that in mind. We know that the surge is coming, but we want to be able to handle that surge so that our medical systems can work as efficiently and as effectively as possible. Now, the task force will continue to very carefully monitor the situation and the resources that we have to respond to it. And before we move on to the Q&A, I did want to take a couple of minutes, and this is really for our healthcare workers that are out there. And I've been seeing things posted on social media and talking to friends and just internal discussions even here at SSM. And our healthcare workers are under a tremendous amount of stress right now. Some of it is overwhelming, to be honest. And I think back to some of my military time where I was deployed overseas away from my family. And I know that some of our healthcare workers now are away from their families for very good reason. They don't want to expose any risk to their children, to their grandparents, to their loved ones. And that takes a toll on you. I can tell you from experience that that takes a huge toll on us as individuals. And so I would ask you to do then as a community what people did for me when I returned from my wartime deployment, and that is reach out to people and thank them for what they're doing. There are truly heroes out there that are doing this work for the benefit of us as a society and as a country. And so if you know somebody that works in the healthcare industry, it doesn't matter if it's a nurse or a doctor or somebody who works in food service or in janitorial services, they're all part of that community. And so if you know somebody that does that, reach out to them. Let them know you're thinking about them. Let them know that you support them and that we're all in this together. And so thank you for that, for being able to talk about that. And so now I'd be happy to answer any questions that the press might have.